You're going to get excited today. We got a heck of a great program. Good morning, I'm Mike Margolis, the outgoing president of the IABDM. And it gives me great pleasure to make a few comments here before I introduce our next incoming president, Nick Myers. Well, Bill, you finally got your wish. You're no longer going to be the immediate past president. So I want to just thank Bill for leading me through the last 2 years and doing this job for the last 4 years before that. To Louisa Williams, Andy Landerman, Felix, who's not with us today, Bobby, who calls in from Italy to join us in many of our monthly board meetings, and that's like 2, 3 in the morning. Bobby, where are you? I know you're someplace. There you are. You were sitting down, that's why I didn't notice you. If you stand up, he's the tallest of the group. And the many other doctors who call in and participate. I want to thank everybody who have come in on our monthly meetings, which are open to board members and members alike. So if you're interested, please talk to Dawn. Carol Rana, when you told us 3 years ago or so that the organization didn't need to go on just to go on, well, we went on because of your leadership and dedication and everything else. But reality has to be recognized, and I was speaking to Bill and others, and well, I feel like there'd be nothing if it's not for our executive directors of this organization. Let it be known, the truth let it be known, that this organization runs because of 2 people who I call Mr. and Dr. Ewing, who encompass everything that the IABDM stands for. If it were not for these 2 people, we would not be here today, we would not be here in the future. I could go on for hours and hours and hours on what they have done on categorizing past lectures, putting things together paper-wise, and making our organization work. But without Dawn and Toby, we wouldn't be here today, and I want to thank them. And your plaque is sitting on my desk like always. So what can I say? If I didn't forget something, I would. Let's look to our future. This weekend we're here to honor the Executive Director of the Holistic Dental Association, and at their last meeting the officers voted to be a part of our next meeting in Tempe. The HDA, Ron King, is here, and where's Sandra? Is she down here yet, Orion?
She's somewhere.
She's in a meeting. Sure. She's in a meeting. Okay, well, they're always in a meeting. We are going to be discussing the possibilities of being sister organizations with the ultimate goal, slowly working towards an ultimate goal, seeing how we can become one organization or maintain 2 organizations that work together. We're not sure exactly where this is going to go, but we realize the fact that Louisa and I were at the last convention and sat there and said, the material is exactly what we would present. The faces are just a little different in the names. Why aren't we one? And that's what we've been talking about, Ron and I have been talking about for the last 2.5, 3 years. So we're going to look at that possibility. And hopefully in the future, we may be able to work something out and become stronger. Because as membership increases, a stronger core group of professionals and a bigger membership, we will be more adept and capable of going on into the future. So anyway, we're going to explore those possibilities. Welcome aboard, and we have an exciting list of speakers to go. Now, you know, one of the things, Bill, when I was introduced as the new upcoming president, you had a phone card that you gave me, which was the passing of the gavel. We do everything by internet. We do everything by emails. It tells us what time to come, what time to do, whatever. And so, Nick, I don't have anything to give you but a handshake and a pat on the back to say thank you very much for being the incoming, or now, stand up, come on up here, because you are now officially, watch out for the cords so we don't mess things up, the new president of the IABDM.
It's good to be here, everybody. This is a first-time experiment for this group to be on a cruise, and this is a first experiment for me to be the president of this organization. I've been a member since around 1993, and been probably to most all the meetings, and have learned the value of networking and also hands-on healing and working on each other and being friends with one another while we're partners in this whole effort of healing the ills and the woes of humanity and those of ourselves. So without too much further ado, I'd like to welcome everybody to participate in the Academy. There are ample opportunities to serve the board and fellow membership so that we have more cohesion and more involvement from the membership, so it's just not left to the few people that kind of are doing it all the time. So please come and join us, and I'd like to have Mike introduce our first speaker there. Wait, not yet. First of all, Michael, you don't have a phone card. We did manage to get a plaque that says the International Academy of Biological Dentistry and Medicine, the President, Dr. Michael Margolis, with deep appreciation for loyal and unselfish service for the years of 2006 to 2008. Signed, Executive Secretary.
That's right. Okay.
And there's an and.
Yes, we have an and. Too bad that Mike, we're doing everything internet. Couldn't come up with a computer to give Nick as the incoming president. That would be nice. But what we have here is for Mike, and what I'm going to do is I'm going to pop this out of the glass, and I'm going to just ask you at some point in time during this weekend if you would like to sign it or jot a note down here to Mike so that he could then take it home as a more personal from all of you all. Okay?
Well, thank you. That's wonderful.
Is that formal Texan, all of you all, instead of y'all?
See, one of the nice
This is product
things
of
is
Texas education.
I went to school in San Antonio, so I kind of know how to say y'all. And, in fact, I still have a son that was born in San Antonio, and he still calls me Dan. He doesn't call me Dad. He says Dan. There are a few paperwork things. Everybody, if you look in front of you, you'll see two forms. One form is Healing at Sea, and it has all the speakers' names on it. Please understand, one of the things that we need to get our AGD evaluations of speakers must be filled out by everybody. We got a way to blackmail you, by the way. Hang on. And then, over here, the IABDM, we would like suggestions for speakers. Not only for this year, but next. And so what we're looking for is your input. Now, in order to get your certificate to show that you were here for your continuing education, you're going to have to return these personally to Mr. and Dr. Ewing to get your certificate that says that you got your continuing education. We'll make extra copies. So Marcus, you'll get your copies. So, without further ado, are we ready for all the other things? It gives me tremendous pleasure to introduce our first speaker. And if you take a look at the room, it looks like we're kind of full. And I know the reason everybody is here is because they want to hear what Dr. Boyd Haley has to say. I don't know how many years I go back knowing Boyd, but here's a gentleman, I wouldn't say he's vertically challenged, but he's taller than anybody else I've ever met in my entire life. He stands on principles, he stands on honor, and he stands on scientific data and information. He doesn't write out what he wants the results to be. He accepts the results as they are and reports them to everybody. He has taken on many government organizations and trade unions to bring the truth so the health of our children and our population and ourselves can be brought forth. Past chairman of the chemistry department at the University of Kentucky, I thought he was going to slow down and retire. Was I wrong? May I introduce to you Dr. Boyd Aiken.
Good morning. It's my pleasure to be here. I look around, I think about 1991, I was invited to give a talk in Austin House, Germany, at John Roberts. I can't remember Bob, I don't remember what. But at first I thought, oh, you guys are crazy. And I really did. I mean, the FDA and the ADA would not allow us to put poison in our mouths or allow the
Let's see.
business.
Okay, we're going to have to get a speaker.
Well, I can talk louder.
Talk as loud as you
Okay.
can, and we'll get a
We'll
speaker.
go on to that. But at any rate, I remember.
Walk a little bit into the room.
Okay, that would be fine. At any rate, I was invited to the first IABDM meeting the year before 1991, and I thought there was a group of toxicologists, and so I went there with all my chemistry slides talking about photophenolating. Some of you will remember it. And I'm looking out at this audience, and I keep studying the students, so I know when I'm not getting my message across. The night after a big drunk party, they don't listen to anything. And I remember one person, David Kennedy, sitting there in front of me, and I thought, this guy seems to be catching it, but I'm not sure. But the rest of these people all had this, deer in the headlight look on their face. And, photophenolating is photochemistry, and it's kind of advanced, most biochemists would know it. And at the end of it, I kind of just looked at it was a group of theorists. I mean, they didn't know anything I was talking about. And David Kennedy raised his hand, he said, Dr. Haley, I'll never forget it. Is it safe? I told you they were all crazy. Is it safe to say that mercury is not good for the body and it might actually see Alzheimer's disease? And I said yes. And that was the only question I got. Then they proceeded to show me that mercury was coming off of the amalgam with Baker's numbers. And I still didn't believe it. So I went home and I got some amalgam fillings and I tested myself and I was shocked. And I thought, well, this will be easy. Well,
This will be easy.
FDA, what's coming out of the amalgam fillings was measured, tested. And my comment, one time I said, I feel like I'm in the 8-year argument with the camera. Now it's 16 years of argument camera. We now have filed a lawsuit with Charlie Brown against the ADA with 6 members, 6 officials. March 28th, we're having a meeting with the FDA with the IABDM. Nice. You guys have to
can't hear.
You have to
You gotta
write.
speak up louder.
You have to write to your congressman. This is nothing more than flagrant intoxication of the American people with mercury. And we're going to show you how bad it is because we've got the science. When they say it doesn't do anything, we'll find out that they're wrong. So, the first thing we did, along with I want to give the credit, I can't think of his name right now, but Dennis for a long time, showed us that you can take an amalgam filling. This is 50 years old. You can see mercury vapor coming off of it. And I did this in my class. I taught a class called Mercury Science and Politics several years with University of Kentucky students. And it's just for the bright students. You can only get in there if I say you can get in there. And what we would do is we'd start out with some presentations about mercury toxicity, and then we would have the students measure the mercury in their own mouths. And then some of the dentists were nice enough to send me teeth that had been extracted that had mercury in molars, and we would brush it, eat it, and we would measure the mercury. You take this type of system, because we can do this. This is easy to do. It's just a fluorescent screen, turn out the lights, and shine a mercury vapor lamp on that too. See the vapors come off. Different hot coffees, with some awful lot more. Brush it with a toothbrush, and it really comes off. I mean, it's very fast. And then you put a mercury vapor sniffer there, and you can see the meter almost go off scale. There's no damn doubt about it. And that's solid science. We now have measured this. I'll show you that in sealed containers, how much comes off per day. It's just several hundred times more than the ADA quote estimates. And what you have to say, if you don't do a simple, straightforward laboratory experiment to prove this that you're covering it up. Especially when we pay millions of dollars a year for transparency policy. Don't cut the FDA any slack. They need insulting, and everyone here needs to write their congressman and say, these people are a bunch of damn liars. Don't cut it any slack, because I've talked to them. They know what they're liars. They are sold out to the American Dental Association. And I get angry when I talk about it. Okay, so, you know, this Rodney Macker, I'm here now in very ill materials person. That means he knows how to make materials. Who doesn't know if we have that class? I listened to the talk. No biochemistry, section of no chemistry, except for Gary and he's an expert. He is the expert. He calls him every time to say out or say. That is the best age you can get. Really wrong. They can't get a chemist or a toxicologist or a neurologist to come in and say this stuff is safe. So to go back and get it. I'm not making fun of them. I know that's one area. But if you're like that, we talk about these philosophies that just work. So they can make an estimation that's just something like something like 0.03 micrograms of mercury in a single mouth per day. And they do that. Here's the trick. They measure the amount of mercury in the urine of an individual amount of services, estimate the number of amount of services, and then calculate the net. Anyone who runs like makes toxicology knows that less than 8% of the mercury to inhale goes out through the urinary pathway. 90% goes out through the oxidation of the brown least excretion, and they estimate that it's math traces of that. So we know they're all. So what we did, the IABDM, because I did this study on my own, it cost less than $5,000. So the FDA paid for it. I paid for it. I had 10 round of 10 plexiglass forms made. I had 10 holes drilled in, hole exactly. One spill, or about one spill. Last year was one did. We sent it out to 10 different dentists. I haven't sent it back. And I think Rich Fisher sent out the amount of manufacturing material for different places. So we know the surface area and we know the weight. Seal containers, we also seal water. Dump the water every day. You know, every Friday, make sure the mercury coming out in that water. And it starts out really hot. I mean, it's all scale. We wouldn't do it on a machine after the first time because it's not a machine. So we waited till, I think, probably 3 months until it got level. And we measured that amount of mercury coming out of the building. And it was level for 28 straight days. Now, rushing it, eating it, anything, we'll show you that on the next slide. This is just what I told them, how we did this. Really, I did the line. I didn't know how who the people were. Here's the okay. This is the stuff. You can see you know some of these people are playing scriptures right here today. And you can see the amount of mercury. This is the micrograms per centimeter squared, or about one, so roughly one spill filling. 9. 8. You do a very good job. Right? You're very consistent. Some of these people, I don't know people, and I have to get a little closer here to see. Because you'll see that. Here's probably one. This one here is 6 all the way across. This one's 12 and this one's 13. These two are very consistent. This one's half. And I think what happens is that the people who manufacture this stuff do not make it consistently good. And you can notice that in the different types of dispersal alloy versus Valiant, you get different levels out. But it doesn't make any difference. The very lowest one here is over 5 micrograms per small one per day. And they're saying it's 0.03. You do the math. They're lying. SOPs. Don't be nice to them. I mean, the problem is we're trained. I mean, I had so much respect for the FDA and CDC until I got into this fight. And now I have any. Here's the other group of people that did the same thing. We can see some of these are up to 16, 18, 19. And I think a lot of it is because I don't think anyone ever tested. They can pass it. See how much there is. How much other methods. They are very inconsistent. But they're consistent all the way across. Like this is the last 8 days. You can see that you go across amazing. But they get by with it. That's the real problem. They get by with it. We sit here, we don't do anything. It's really caused a lot of damage. So, this is from doctor's data, and I...
Time up for 1 second.
In an effort to improve
The audio.
Ellie's voice, if we can just have 2 minutes, so they can set up the microphone and everybody.
1, 2, 3. We need a bit more volume in the back.
No, that's great.
Testing, 1, 2, 3. Test, test, test.
Okay, go away, test.
Bye.
Only
You're
your
right,
wife
see?
can say that.
You told me to go away, I go away.
Toby.
We'll get some lights on for you.
To the side, so.
Over this
Yeah.
side so she
And,
can.
yeah, and then lights. Back here. If I have to keep working here, I may have to get some clothes on. Oh, lovely.
Can you hear me now?
No.
Now?
Okay, I'm gonna go make copies, folks, and we'll be back.
Louder.
Turn that up.
Oh,
Hey, Elvis, come
I can't
on.
stand that close.
Can you turn it up then?
Yeah, we'll do.
Okay.
Okay, yeah.
Can you hear me now?
If you want to walk, you can do
I
that.
got you.
Pull it out.
No, no.
Now, how many things can you hold
I'm
at
not
one
so I
time?
said.
I can do it. So this is data from David Quigg, doctor's data, and he took samples, from fecal samples and had people, check off how many mountains they had, and the average person had 60 micrograms of mercury in daily excretion of feces. That's a lot more, and that tells you right away. The ADA estimate is way, way off. I mean, this is when people were probably excreting, some people probably aren't doing such a job of it. And what I want you to do is look at the 540 nanograms per gram of feces. That's what he found on average. And on this slide, ADA likes to say, this tells you just how bad our government is, how bad the regulations. Because I think it was John Roberts who first called my attention to this article. This is from children who died with idiopathic dilated cardiomyopathy, or sudden cardiac death. And they're usually young, and they're usually male, and they're usually athletes. And they have only 178,400 nanograms per gram of mercury in their heart tissue. That mercury, we've now done some work on people who have died of sudden cardiac death. It seems to concentrate in the left ventricle where the atrophy occurs. So we have a major disease that kills 300,000 Americans a year. It was published, again, not done in the United States, but done in Europe, I think in Italy or Switzerland. And we published this in 1999. We're now 9 years past that, and our NIH has not called for one research proposal to look at this ever. We do not and will not in the United States support research that shows that mercury is toxic and causes anything. I think the toxicity may be too important to the drug companies. So if we look at this, if it's going out at 540 in your feces, how can you concentrate such a large amount in the heart tissue? And not a person sitting in this room has seen anything like this level ever in blood, urine, or fecal material. Mercury is a retention toxicity. It concentrates in certain tissues, and it causes death, and you cannot say it's safe by looking at the level in the blood or anything else. It's just not that way. And that's just common sense. And so we have to look at this, and I think this is one of the major things we're doing. And right now I'm trying to get a study. As soon as I get some other things done, we're going to get hundreds of heart tissues from people who have died of sudden cardiac death. And I would point out, in the atrial tissue, there was higher mercury, like 500 nanograms, but most of them are like 7,000, 8,000 nanograms per gram. And that's when you die of that disease. You don't have any infarction. Your heart just stops beating. And I think the cause of that is mercury. And maybe some other heavy metals, but primarily mercury. This is a famous study. This is a study that was funded by the National Institute of Dental Research. This is the kind of work they used to fund. They funded it through Washington University. They did it on infant children or orphans in Portugal. This is in Portugal. Now, why would you pick Portugal? Seaport, poor, orphans, eat a lot of fish. So you don't have any may percent increase, and that's what they talked about. The level that goes up here is not much over the basal level, which is reasonably high. But when they what they did is they put a composite fillings in half the kids, mercury fillings in the other half, and then they measured one time a year the urinary mercury level. And with boys, I mean, when it went up, we can talk about it. This was all based on the creatinine adjusted urinary mercury, which is more accurate. You can see in the first 2 years with the amount of fillings, the level went up as they increased fillings, but they increased fillings all the way across. They put fillings in these children every year, every 6 months, and they had down check and fillings to get. Why did this drop down? They put this as their data, and they didn't talk about that. But you don't stop mercury coming off the fillings in 2 years. You do a calculation with the half gram filling, that's 250,000 micrograms of mercury. Take 5 into that a day, you realize you have enough for 30, 40, 50 years. 100 years. This mercury, what this is showing, anyone that studies toxicology, is that these children are losing their ability to excrete mercury from the kidney. The kidneys are becoming toxic and unable to transport that mercury out, or their system is dropping down. And what happens is that mercury goes out after being connected. Mercury doesn't leave the body by itself. Mercury has to be connected either to cysteine or glutathione or some other molecule before it's excreted. Straight Hg2+. Why would it go out in water? It hates water. And it's got all the fat tissue in your body concentrated. So we know it's not doing that. And we asked them, I challenged them several times in the meeting, what's the difference between boys and girls? And Dr. Jim Woods published this. And now keep in mind, when we do this, boys are 4-to-1 ratio of Alzheimer's or autism spectrum disorders versus girls. And if you split that data up into two, you look at the girls, first of all, they excrete it at a higher level. You see the level goes up and it stays relatively level across the time frame of a 7-year study. If you go to the boys, they don't go nearly as high as the girls, and they drop down. At the end of 7 years, they totally lost the ability to excrete mercury. This is a comparison of boys and girls done by the opposition's data, and yet they usually look at this and say, what the hell does this mean? And we have a real problem, and the problem is that we have a level of stupidity and crookedness that the FDA is just not willing to like.
Well, the last comment down there, the sex comparisons were not altered significantly. You just showed how significant that is.
Well, no, the sex group, I mean, by adjustment to create.
Oh, to create.
Yeah. They believe this. Now, Jim Woods, by the way, I think is a really good scientist. I don't know why he's working in these areas. But I would point out one thing. You know, the John's work in Paris on the urinary port profiles of dentists, etc. They did that work on these children. We have sued them to try to get their answers. They have never published them. And they say, well, we haven't got the data worked up. I want to tell you, to do urinary organ profiles in a lab like Jim Woods would take maybe 2 weeks. It would have been the first thing. That data is the easiest to use. They refuse to present to the public urinary organ profiles on these children. And you can damn well bet they're mercury toxic. Bet that there have been major changes. In the United States, for those of you who don't know about the top study, he measured the urinary organ profiles. And Dr. Woods, plus many others, many years before him, have shown that, and we'll talk about this a little bit later, but the urinary organ profiles is a series of compounds that's used to make heme, or hemoglobin. And when, and there are about 6, 7 steps in there, and medicine inhibited at specific locations. So you can look at the urinary organ profile and tell whether the person's mercury toxic or lead toxic, or toxic from pesticides. And they've done this study on these children. And they found, and they won't release the data, but when they did it on dentists like yourselves, they found that dentists and dental technicians, that 85% of them showed urinary organ profiles indicating that they were mercury toxic, and that 15% of them were severely affected. And that's published by Dr. James Woods. Anyway, what this slide shows is that mercury vapor decreases the child's ability to excrete mercury through the kidneys, and it especially affects boys. This is consistent with well-known toxic effects of mercury in the kidney. And this explanation is consistent with reports of EPA and the National Academy of Sciences that 8 to 10% of American women have such high mercury body burdens as to render susceptible to neurological diseases any child they give birth to. If you live in New York City, it's 25%. That's posted in the newspapers. I mean, that was, I'm not making that up. So we have a problem. We have the National Academy of Sciences and the EPA saying, my God, we've got mercury toxic people all over the place, and what do we blame? Fish. The safest form of mercury that you can be exposed to comes from the fish. It's been in a living animal, it's tied up with selenium, glutathione, because if it weren't, they would die. And the test that we did on with a compound I'll talk about here, we started out by buying bowls, goldfish bowls, and putting 3 goldfish in each bowl, and adding mercury to the bowls to see how long they live without the compound. And without doing anything to the compound, mercury kills goldfish in 10 minutes at very low levels. So fish aren't safe from mercury. It's just that they tie it up. It's a slow exposure. They tie it up with selenium. If it's seafood, they tie it up primarily with selenium and other things. And when you eat it, and this is Japanese studies, most of that mercury goes straight through your body. It does not, it's not maintained. It's not digested. It's not taken up by the brain. So we now, well, some of you wouldn't go that far, but I'll tell you, if you look at the science, I mean, we're telling people not to eat salmon, and what I would point out, people who eat salmon or fish have much less heart disease than people who don't, and they're getting exposed to more mercury. So you better understand the biochemistry of what goes on here. This is the koi crisis in the USA, and the reason I bring this up is that 3 days ago in the Lexington Herald Leader, they had an article, koi crisis in the USA is the one. Now, many of you remember 10 to 15 years ago, we had concerns about the fact that boys stomped the girls in math and science SAT scores. They did better, and they were saying it's because boys are more aggressive, they get more attention from the teachers, and they do better in math and science. That was 10 or 15 years ago. It was a big thing. They were thinking about separating the girls from the boys in the classes. Today, we have to practice affirmative action to get boys into medical school, dental school, graduate school, etc. They don't even graduate from high school very well. Their scores on the math and science have plummeted, and the girls now beat them, like a drum. We have to actually leave, and the argument was we're keeping girls who are more qualified than some of the boys in medical school. They can't get in. They're being excluded because we have to have 50% boys in medical school. That's a fact. It's in this article, Boy Crisis in the United States. Go ahead and Google it, and you'll see what I'm talking about. Today we have to practice affirmative action. I strongly suggest that it was the CD mandated vaccine program that caused it because it flipped. Right at the time we started vaccinating in 1988-89 infants with elevated levels of mercury. The scores of the boys have just gone in the toilet. They have a lot of neurological problems. The autism rate went up through the ceiling. This is really a bad problem. Now, let's talk about something in solid science, and this is a new find that most of you have not heard of this. There's an enzyme, and you can go to Google and Google it. It's called matrix metalloproteinase. It's the enzyme that chews up collagen that holds your cells together. It's the enzyme that chews up the connective tissue that causes the detachment in periodontal disease. It's elevated in cancer. And we can go down through here, and I don't want to go through it, but here we say congestive heart failure, atrial fibrillation, acute coronary syndrome, extracellular matrix including breast and squamous cell carcinoma, ovarian cancer, Alzheimer's disease, amyotrophic lateral sclerosis, MS patients, abdominal aortic aneurysms, increases the aggressiveness of renal cell carcinoma, solid tumors have this overly expressed. What it does is it chews up collagen, and it causes you to have leaky gut syndrome. It causes the problem that you have. And what we've done, and what we're going to show you, is that mercury and ethyl mercury both activate the common form of MMP. It irreversibly activates. Now, to explain this to you, this enzyme, this is the enzyme, and its active site is sitting right holding this end. And it has to bind collagen like this, reacting. When it's in its pro form, or the form stored in the body, there is a cysteine that interacts with the zinc, like in the palm of my hands, and it's inhibited. When you have cell damage, tissue damage, this thumb is clipped off, and it's opened up, now the substrate can bind here and be destroyed, be chewed up, the collagen. That's cysteine, and I looked at the structure of that, and I thought, this looks like an enzyme that might be activated by mercury, because I know mercury will replace the cysteine zinc bond very quickly. So we did a study. We did a study in which we put collagen in about 10 test tubes, added matrix metalloproteinase, the enzyme, added different levels of mercury and thimerosal, which are preservative in the vaccines. And this is kind of hard for you all to follow, but this is the collagen here. And here's what happens if you add 4, which is this plus mercury. Here we had 2 millimolar. 6 right here is a 10th millimolar or 100 micromolar thimerosal. Since then, we've repeated this, and we're now down to less than 1 micromolar when you full activation. As a matter of fact, the enzyme is more active at low mercury concentrations than it is high. So what we're having when we have a constant flood of mercury from downhouses going through our body, or any form of mercury, we are constantly activating the enzyme that causes an aging process. Leaky gut, cells that aren't connected properly, periodontal disease, and for the ladies in here, wrinkles. I mean, the lack, if you put collagen in here when you have wrinkles, that's because the collagen's been eaten up as you age from the destruction of the side. So there's no doubt about this. This is the one enzyme that is dramatically activated by exposure to mercury. And there can make no argument about the levels. And if you go back, if you have 200 micrograms per liter, you have 1 micromolar, and you fully activate this enzyme. So we have problems here that we have to deal with, and we're preparing this for publication right now. But the data is just too dramatic. Here again, that's the original stuff. Here's treatment with, a little bit of, yes.
How do you reverse the activation of an enzyme?
Take the mercury off of it.
So how about any other biochemical?
Oh, it's like every enzyme. It has a life expectancy. Once you activate it, it'll get processed and you lose its own activity after a period of time. I mean, no one knows that, how long it lives in the body once it's activated. But evidently it lasts a long time. Yes?
What's the difference between the action of the body between mercury fillings versus aerosol?
None that we can see.
Why is there such a
Well, there were different concentrations that we added. You have a lot of mercury in your body, amalgams, etc., but you don't get that much thimerosal concentration-wise. And I was trying to say, we're injecting this into a day-old baby. And if you understand, 80% of autistic children have severe gut dysbiosis. If you read the work of Andy Wakefield, they have leaky gut syndrome, or whatever you want to call it, enterocolitis, that's very severe. And it's one thing that later on we'll talk about ways to reverse that. Anyway, this is the first experiment we did, but also it's kind of, you tell we weren't planning on publishing this, but I wanted to present the data that I found. We've done this now about 4 or 5 times. Every time we keep dropping the mercury concentration down, and what we're finding is it's more active at the lower concentrations. Yes.
Some of the naysayers say that there was they're not tasting mercury fillings in California any longer, but there's no reduction in body quantity.
No, that's not exactly true. What you're talking about is the fact that they said they took the thimerosal out of the vaccines and there's no reduction. Okay. This is the kind of politics that happens. They made the statement in 1999. The CDC and the American Academy of Pediatrics recommended that thimerosal be taken out of vaccines. That doesn't mean they did it. In this state, any state that except California and Missouri today, a physician can buy thimerosal-containing vaccines and inject it into children and be totally within the standard of care. Their statement that the mercury was out in 2001 is totally false. California made law. I know I played a part in testifying for the people that thimerosal would be removed from vaccines in 2006. In that study, children have to be at least 3 years old or not included in the California database. So if they did in 2006, that means that the first group of children that are absolutely for certain thimerosal free would come up in 2009. And now they talk about that as if the CDC makes a suggestion and everybody follows it. Most of the children vaccinated in California were members of an HMO of some sort. Now, you think of it this way. If you are the buyer of vaccines for the HMO and you want to save money, and a single vial, single dose costs you $5, and I don't know the exact amount, but you could buy 20 doses in a vial for for $2 a dose, and you're going to buy thousands of hundreds of thousands of doses, which one are you going to buy? Especially when the CDC, the American Academy of Pediatrics, tells you the aerosol is totally safe, those vaccines don't cause any problems. We've got the data to show that. Those children were not vaccinated with the aerosol-free vaccines. The other aspect of this is, at the same time, the AAP and everyone in medicine says early diagnosis of autism and early treatment is critical if you want these kids to recover. So what you're seeing right now, at this time frame, is that people are diagnosing autism much earlier than they ever did before. Because essentially there's nothing, before they said there's nothing you can do about it. It is a non-treatable genetic disease, is what medicine said. It's not true. Children are being treated and reversing this disease. So doctors are now looking at these children and they have this blank stare at 2 years of age, 3 years of age. They say this is an autistic child, let's start treating. Whereas before they let it go on because there's nothing they thought they could do. So that study is just nothing more than what we call manufacturing uncertainty. And we'll talk about that later. I'll go into that. But just look at the fact what home they do. We know that the Amish do not have autism. The Amish do not get vaccinated. Can you get the CDC to look at that population, the non-vaccinated population versus the vaccinated population? Absolutely not. They absolutely refuse to do that. That's a good question, but it had nothing to do with the mountains. This is working now.
Next slide.
Is that the next? Was that the next slide? Okay. Well, I can do it. I'll just go with that. The reason I got in this fight was that without knowing anything about General Motors or Mercury or wherever it came from, was that I was studying, and I'm an expert, because I published the active site and everything about this material called tubulin. Tubulin is a small molecule, it's a dimer, and it lines up and it forms these straw-like structures that go from an axon. It's a major protein in the brain, and it actually behaves as a railroad track where membrane-bound organelles get on a little molecular motor called dynein or kinesin, and it tumbles from this direction all the way down, burning up ATP. This is the railroad track of cells. And how tubulin works and what's involved in is very important. It's also used in dividing cells. The immune system has a lot of tubulin in it. And I worked on this in 1974, published papers on it, and didn't know that it would do anything other than just as an intellectual curiosity. However, in Alzheimer's disease, if you come to anything like this is a normal neuron, and you have all these dendrites and axons coming out, they will all be truncated. And up at the end of it, you'll have what's called a neurocriptary tangle, because what they don't show here is that there are fibrils that come down through the axon, which give the direction of growth of the dendrite or the nerve fiber. And it comes down here. What we found, I moved to the University of Kentucky Medical Center. One of my graduate students worked for an aging center, working on an Alzheimer's project. And what I was famous for is this project. It's called nucleotide photoaffinity labeling. Well, what it does is, and I can't explain it to you. I can't explain it to chemists a lot of times. But it's just a process. We can take a diseased tissue and normal tissue, and if they bind a specific nucleotide like ATP or GTP or cyclic A, you can put this compound in a radioactive form, let it bind the proteins, and get it with a flash of light, and it will literally explode, and it will bind to whatever protein it's sitting on. So if you have, say, a protein like tubulin in this case, that's active in normal brain, you'll put a radioactive tag on those tubulin protein molecules. If those molecules are inhibited, for example, with mercury, it won't bind to them, and so it doesn't photolabel. It doesn't put a radioactive tag on them. You can separate these out on a gel, and this is how we do that. Now, what I want to tell you is that I have a company called Affinity Labeling Technologies in Lexington. We sell these compounds all over the world. Our biggest customers are National Institutes of Health. This technology is proven. It's not Star Wars. It was Star Wars in 71 and 74 when I invented it, but not anymore. Everybody uses it and uses it exactly like we're talking about here today. Here's the experiment. Here's an Alzheimer's disease brain, and these are normal brains over here. This is the molecule that photolabels with the GTP, and that is tubulin. We proved this by doing antibody detection at this site. If you add small amounts of mercury, photolabeling of that compound disappears, whereas the photolabeling of this compound does not. There's another control, you increase mercury, and it goes down. Now this is done in a test tube, and it takes about 20 seconds. If you go over here to the AD, treat it the same way, you can see that protein, even with no mercury, doesn't show up. We published this, and everybody agrees with us, and it fits in with the pathology you see in the AD brain. Tubulin that connects one neuron to the next in a deceased Alzheimer's patient is almost over 80% dysfunctional. And it is not working. And we've shown studies that do it even easier than that. You take the brain tissue and grind it up. Tubulin is a water-soluble protein, so you spin it down to the brain, and all the debris goes down except the tubulin in a normal brain. That's how you purify tubulin. Grind up the brain, you take it at 0 degrees, the tubulin depolymerizes, doesn't form those straw structures. You spin down the debris, and the tubulin is all in the cytoplasm vein. Unless it's an AD brain. It's an AD brain, it all goes down in the pellet because it's abnormally activated by heavy metals like tubulin. Now, when I published this, they didn't mind this part, that it wasn't there, but when I showed them mercury, they did that. We did this is a study, we did it on everything. And there's cadmium, copper, and zinc, and you can see that in the presence of the chelator, tubulin is still active. If you go over to mercury, even if you have an excess like this is 2.5 micromolar, it's in the presence of 100 micromolar EDTA. I mean, it's a huge excess affiliating agent, organic acid affiliating agent, and this causes this brain, this human brain, to behave just like an AD brain. So what it's telling you is that the organic acids, the citrate, malate, fumarate, and other things that are in your brain that might bind lead, arsenic, cadmium, etc., will not bind mercury and prevent mercury destruction of the neurons. Now, this got me in a lot of trouble. I mean, the medicine did not want to hear this. And I think the main reason is because there's absolutely no money to be made here. Take the mercury away, these people won't have brain problems. You can't give them a drug, and they have spent billions of dollars on research to try and find a pill to get all of you folks that are now getting up in that range to make your brain not fall apart. They could make billions. Go look at it. Just go in there and type in Alzheimer's drugs, etc. You'll see that just about every pharmaceutical company has 4 or 5 compounds in the pipeline to treat all the older folks, the baby boomers are getting up there, so that you won't become demented. It's money. It's just absolutely nothing but money. And recently, at the University of Rhode Island, they put out a paper saying they were doing a study on monkeys and the effect of lead on their IQ. So they treated them with lead at a very early age, lowest amount of lead, not enough to kill them, but enough to affect them. They weighted these monkeys down, they put them at 35 years of age, and they looked at their brains were loaded with amyloid plaques, and they said perhaps lead exacerbates or causes or is one of the forerunners of Alzheimer's disease. So somebody else is now saying this is possible. If you look at amyloid plaques, which is again the second diagnostic hallmark of Alzheimer's disease, they have no measurements. They are loaded with zinc and copper. Guess what they didn't measure? I know the guy who did it real well. They didn't measure mercury. Because I asked him, why did you look at mercury? Well, I don't want to lose my brains. That's just how, and that message has been made very clear to the research community in the United States. Now, favor saving of the ADA, it doesn't come out, mercury coming out of the mountains, God has blessed it, and it doesn't cause any toxic problems. So this is a study. We took an amalgam, did a tube, put it in a test tube with water, and we took it out at these various times, 0 to 1 hour, 1 to 2, 2 to 4, all the way out here 96 to 120, and then we took that water and added it to normal brain to see what effect it would have. And this is 100% jubilant liability in the control brains that we did that in, and within 1 hour, the water was so toxic that had the amalgam soak in it that it, it get rid of 80% of the jubilant flow rate. So the mercury coming out of amalgam filling is not safe. Their argument was, well, you're doing this in a brain, it's not in a living animal. Animals have which is a good argument. And so we did rats. We did this with Rich Lorscheider and Murray Hemming. And what we did is we took rats and put them in a thing where they had to breathe mercury 4 hours a day, every day. And we did this on a 2-day dose. And we looked at this. This is the tube flow level in the controls. It's up here. The mercury level's down here very low. After 2 days, the tube is still boiling, and the mercury level has gone up dramatically, here to here. And that tells you you have protection in your body against mercury exposure. But if you go out to a 14-day dose, you look at the tube, and it has totally become dysfunctional. These rats are still eating, moving around. I mean, it's like they don't know what they're doing, but they're still alive. And the mercury level went up this high. So as the mercury level passes this, it goes up to here, and you see the tube labeling drop down. And if we look over here, here's a human control. There's the mercury in the brain. They got more mercury in the brain than rats. I'm telling you guys, you don't have to worry about it. That's the level of mercury in these human brains up to here. And it drops down. But if you look at the Alzheimer's, the tubing is way down, and the mercury level is slightly higher. And it's just that maybe that this process here of that change plus genetic susceptibilities is what causes this. So all we can say, if you breathe mercury vapor, the tube in your brain is going to go pop. It's going to go, and you're going to lose your neural connections. And that's the reason they have the Mad Hatter complex. There's nothing shocking about this. The only thing shocking about my research is that the Food and Drug Administration won't listen to it. As you notice that whenever the ADA attacks everybody, they attack Lorscheider, they'll never mention my name. They don't want people to even read those papers. Now, this is something that was done by me, unlike Rich Lorscheider, you've all seen the Calgary movie. And if you look at this, mercury, and again, in that test that we did, we showed that mercury and only mercury would cause that effect. When we added different metals to cause this diluted neurofibrils, you can't see it very well on here. Mercury, only mercury. Lead wouldn't do it, aluminum wouldn't do it, etc. It is a mercury-generated disease. And this was done on neurons and culture. And the movie is very compelling. But to prove it just like we did, we use antibodies, and if you check tubulin, this green stuff, or green shell stuff, is tubulin antibodies binding for tubulin. Before you add mercury, and after you add mercury, that tubulin is totally gone, and you can see that the red stuff is the active antibodies on the outside in the growing phase. So we have all kinds of proof. If this were any other element or any other material, everybody would be taking it seriously. We can thank the American Dental Association for arguing that this needs done. And they control the Food and Drug Administration in the aspect of their mercury and evaluation of mercury filling. In the brain, and most of you know what creatine kinase is. Creatine kinase is the enzyme that takes the energy that's produced in the mitochondria, puts it on creatine phosphate, transfers that creatine phosphate out into the cytosol, and it gets reconverted back to ATP or making proteins, etc. Creatine kinase is 97% inhibited in the AD brain. We proved that at the same time we did some of the typical stuff. Nobody argues with that. And creatine kinase has the most active sulfur group known to biochemists. In an active site where it transfers the phosphate from ATP to phosphocreatine, has a sulfur break deeply in the active site. It is well known that it is exquisitely sensitive to mercury, and it's 97% inhibited in AD brain. So why in the world would you approve a product with more mercury in your brain that would push anybody that's susceptible to Alzheimer's disease over that realm where they can't transfer the energy? It's inside the cells to the locations where it's moving. And this is a study. Again, we took water, exposed to an aged amount, real old amount in the tube, dropped it in purified water, took out, let it sit in there for 15 minutes, an hour, 24 hours, because we didn't know how long it would take. This is the control, and you can see the assay time starts here, here, here. They're making a lot of creatine phosphate. We're seeing how many transfer radioactive phosphate from ATP to creatine to make phosphocreatine. And it works really well in a normal brain. If you soak it 15 minutes, it's there, 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 and there. You have this much information. If you do it for an hour, it's this much information. As you can see, there's no doubt about it. And not only that, you do a biochemistry shock if you do the parameters. It's just, there's just nothing about this that's magic.
Can we take a
It's a protein. It's a cholesterol-carrying protein that's made, and it's a housekeeping protein. It takes cholesterol out of the brain. So it leaves the brain cells, goes into the cerebral spinal fluid. The second highest concentration in the body is in the cerebral spinal fluid, and it clears the CSF, the cerebral spinal fluid, goes into the blood, and you clear this out into the kidney. And the major risk factor, there are 3 types: 2, 3, and 4. And you get one from your mom and one from your dad. And all I want to point out here in this first slide is that if you have 2, 2, you'll never get Alzheimer's disease. And if you have 4, 4, you're at very high risk for getting Alzheimer's disease. 3, which is the wild type and the most common form, is somewhere in between. But even if you have 3, 3, you're going to be rather old before you become demented on that. Next slide. What's the difference between these two? And if you look at ApoE2 at position 112 and 158 on the protein structure, the primary sequence, you have 2 cysteines that combine 2 mercuries. When you go down to the ApoE3, you have 1 mercury site. And when you get to ApoE4, you have lost all the ability for that protein that's leaving the brain, going through the cerebral spinal fluid, into the blood, that combined mercury and be excreted. You've lost it. You are more susceptible. It doesn't cause Alzheimer's because there are people that are 4, 4 don't have Alzheimer's disease. They're probably not exposed to mercury out there. So this is a genetic susceptibility that fits into this aspect. Next slide. So if we look at this and say, here's your ApoE2, the E-type 2, 3, and 4, the father inherited versus that's mother inherited. And if you get 2 2s, you have 4 cysteine groups per unit of the type, and you'll be over 90 years of age. And if you have 3, you'll be over 90 years of age. If you go down here, we have 0 of these cysteines at 7. It fits perfectly. And we proposed this. Other people have picked it up. And I think people now believe this might be a possibility. But this fits into the genetics of what we see. Mercury is causing destruction. Because if you have this barrier of ApoE2 and 3, you're less likely to become demented because you chelate the mercury out of your brain. In the cerebral spinal fluid, even in the blood, as you go through. Next slide. Okay, now, we're going to jump into certain diseases. The ADA will constantly tell you that there is no proof that mercury causes any kinds of disease. We all know about cowbells, curious chloride, Hg2Cl4. I mean, it's the HgCl4. HgCl, 1+ charge on the mercury. That compound is in calomel solutions. Calomel lotions have been used forever in medicine. And in about the late 1800s until 1940, there was a disease called acroleukemia, or pain disease. 1 out of 500 children had this disease. It looks very similar to autism, except it didn't come at 2 years. The patient came after teeth. And a doctor in Cincinnati noticed that only his wealthy patients had this problem. The Indians and the blacks, poor population, did not have pain disease. So he went back and he looked over their schedules, and what he found the cause was the teething powder. These people use teething powder that contained mercurous chloride to kill the pain. Now, why would mercurous chloride kill the pain? You put it on your itching skin, put it on your teeth to break through, because it causes you to disrupt if your neurons don't work right. It works well in the treatment of disease, but it also causes these children to have pain disease, and a lot of them die. A lot of them got sick. A lot of them never recovered. They found when you remove this teething powder from the market, the disease disappeared. You don't hear about pain disease anymore or academia. It's a very, very rare disease. There have been 5 cases in the United States. They were found in the state of Texas, and they found that the cause was a calomel lotion used for diaper rash that was placed on children that was smuggled in from Mexico that had much higher levels of ferrous chloride than was allowed in the United States. They've just dropped it down to the mercury. So I will point out to you that ethyl mercury, which comes off of the aerosol, is many times, hundreds of times more toxic than the ferrous chloride. And so the lethality alone is not the only problem. Go to the next slide. But I think when they say mercury has never been shown, look at IDCM, the heart disease problem, the sudden cardiac death, and we look at big disease, absolutely directly tied into the high levels of mercury being exposed to. So what's our current situation? This is about 2 years old now. The drugs to treat behavioral disorders, autism, ADHD, has increased dramatically, over 369% in the recent past. We now spend more money to treat these children than we do on antibiotics and asthma drugs. 1 in 6 children in the United States have a neurological disorder, according to the CDC. Not my numbers, but their numbers. We have a major problem, and yet this group here, all the way through here, more effects of mental health exposures to mercury. Nothing about it. For example, if you read the literature, you've seen it, like the California study that this gentleman back there just mentioned. There's another one that was done in Argentina where they injected children with the nurse-all-containing vaccines and made the statement that the mercury leaves the blood too fast to be toxic to aerosol. And we'll talk about that in a minute. They spend more time and more research trying to prove that exposure to mercury is safe than they do trying to find out what's causing our autism epidemic. Right away, we see we have a problem. Now let's talk about the aerosol. The aerosol is thiosalicylate coupled to ethyl mercury. This is the molecule. And the reason they did this was that if you want to kill something in a vat of water, like you're making a vaccine protein, you have to have this thing water soluble, otherwise it'll just float on the top and it won't work. Ethyl mercury, which is the toxic component, is water insoluble. So when you couple this to this, you make a water soluble reagent to spray on seeds, prevent fungus from growing, and you'll see a lot of Iraqi, a lot of Swedes, a lot of people got sick from mercury on seeds that they put on there to keep the fungus from growing and kill the body of the seeds. But this compound that breaks off in your body, where would it go? Right in your fat tissue. It's lipophilically studied on lipid here. So when you put this in the bloodstream and it breaks down rapidly, this, which we know it does, do this in salt water, rapidly displaces this bond, and this would partition into the fat tissue of your brain, and yet this idiot, Chero, wrote that, said, well, the fact that it disappears from the blood indicates that it's not in the body long enough to cause toxicity. I mean, look, that's scientifically, I mean, if I had a graduate student that came up with that level of thought, I would suggest him going to court. Yes?
Yes, so thiosalicylate being thought of as a distinct as well.
Oh, it could be, yes. It would be as much as, say, glutathione has one S and one that applies. So thiosalicylate could be a water-soluble pigment, yes. But what we do know is that ethyl mercury is incredibly toxic. Now, this is where the dentists who do paranormal research. This is something that came up because we all said, well, mercury enhances periodontal disease, etc. And I just want you to know, mercury coming off of the mouth, it's oxidized rather easily to H2+. If you have an avial tube, the root canal, etc., that's loaded with anaerobic or periodontal infection, cysteine comes out, and they convert that to hydrogen sulfide, and thionine is converted to methyl thiol. This is what gives you death. This is what we measure in the Topaz test. We measure primarily these two compounds, plus in the saliva. These cells are breaking down glutathione. If you read the literature, there are several things that are up in peripheral fluid people with periodontal disease. Hydrogen sulfide, methyl thiol, cysteine, glutathione, and glycylcysteine. They're elevated in these things. That's the reason that test works. It was measuring 4 or 5 things, where if you take the allometer, you just measure this one. So it does work, and that's what it's sometimes it's two cents, and really it may be. But if you look at this, these react with this forms the HGS. That's the amalgam tattoo. You see someone with a purple gum, they have an oral infection. because they're precipitating out mercury sulfide and silver sulfide in that region. However, it's the methyl-thiol is dangerous because you make these two compounds, methyl-thiol-mercury and this compound, and we've tested these with cells in culture. They're as toxic as can be. I mean, they're more toxic than mercury alone, primarily because they're very hydrophobic, they rapidly partition, they pass through the cell membrane, and they cause a lot of disruption. So anybody that has amalgams and periodontal disease, it really is severe risk. You remember the lady, Dr. Karen Whittingham at Dartmouth University, that spilled 2 drops of dimethyl mercury on the glove he had and died within 10 months after going through a very painful death. There's not much difference between that compound and this compound with regard to its hypertoxicity and its toxicity. Okay, next one. So that's one right. Now, let's talk about relative IQ of the Food and Drug Administration. This was published in 1977. It was in a hospital, and obviously this is effective report. They treated 13 cases from 69 to 75 in this hospital, and 10 of these children died. And part of the treatment was to take merthiolate, which has as its active ingredient Marisol, and they painted it on the infected umbilical cord, and it was absorbed into it. Now, I grew up with this stuff, and it was many children. All heavily painted with this red material. If it made me dumber, I noticed. So the bottom line is, it's really infants. Infants don't make blood. They have very low biliary output. That's why you don't feed them steak sandwich the day after the morning. You can't get rid of the mercury. You and I can get rid of it. Once you're past adolescence up in that age, you have an infected kidney, liver, glutathione transport system, etc., and you can get out of it. Infants cannot do that. Now, put that in mind, we'll talk about it later. Recently in Canada, Manitoba University looked at children that were vaccinated at 2 months versus 4 months with the DPD vaccine. Those vaccinated at 2 months, 16% of them, roughly, very close, developed asthma. If they waited 2 months longer, they went down to 5%. So the date that they got the vaccine played a major role in the triple the rate of asthma. And in the United States, we gave it to them on the day of birth. And our asthma rates have gone up right like our autism rates. But in this thing here, this was 1977 and 1978, they outlawed it, took the Marisol off the market, and then some Einstein at the CDC decided it was a good idea to inject it into babies and leave it in our vaccines. And this conclusion down here, organic material antiseptics should be heavily restricted or withdrawn from hospital use. The fact that mercury rarely penetrates intact membranes is highly toxic and seems to have been forgotten. And why I'm telling you this? In the 1940s, Marisol came into play with the biologicals in the early 1930s. First cases reported a significant number of autistic-type children, children with that syndrome, were reported in 1949. Autism was not known as a major underlying significant disease before the advent of this type of compound and the use of this in biologicals. We have the next slide. Now, this is the one to remember because this fellow, Cheryl, I can't say his name very well, P-I-C-H-I-C-H-E-R-O, published this again, coming up with the idea that the mercury inside the blood is like alcohol. If you don't have alcohol in your blood, you're not done, right? I mean, you have to be an idiot. Alcohol is a metabolite. You can metabolize it. Mercury is an element. You can't metabolize it. It's retained. They did this study, 1975, used radioactive mercury into Marisol, they injected it into rabbits, and the blood level decreased from 100,000 counts to less than 25,000 counts for over 75% in 6 hours. He says the half-life of Marisol in the blood is something like 5 or 6 days. So, of course, not very long enough to be toxic. How long does it take you guys to get darkness? You drink your margaritas. Did it take you 5 days to feel the effects? And it's not mercury in your blood or the alcohol in your blood that makes you drunk. It's the alcohol that's in your brain. At the same time, this was going down. So concentration of mercury increasing in your brain 2-fold, liver 4-fold, and kidney 3-fold. And yet, this is their standard. IOM, CDC, American Academy of Pediatrics states that the rapid loss of mercury from Marisol from the blood makes it unlikely to cause autism. That is stupid. That's stupid science. Anyone that talks like that should not be allowed to follow science. And if they have doctor in front of their name, they ought to be removed. You have to be how stupid they appear, because as bad as they are, the American public buys this, and our journalism media will listen to everything they say and report it as if it's a God-given fact. Never is. This is the big mistake. CDC said it was okay to inject newborn infant levels that the EPA say give the infant weight 175 pounds.
That's one hell of a baby.
It's a hell of a baby, right? If you understand that we are all drinking bad water leading back to 2/3 of the metallothionein that binds heavy metals is located in our intestines. And they made this safe level on children in Faroe Islands that ate fish. That mercury is not that toxic. I mean, over 80% of this type of not bioavailable toxicity. It's not usually high level mercury. I don't eat shark. Let's put it that way. I eat salmon. But when you eat it, and it goes down through your gut, and your metallothionein binds that mercury, and it never makes it into your body. When you inject it directly in a vaccine, or you breathe it as a mercury vapor, it has its full reaction potential, and it bypasses 2/3 of your body's protective system against toxicity. And it's just this incredible inability that just drives me up a wall. And not only not think, but not listen. We will present this. I mean, I'm happy to fight the big body universe, and only one person that's a medical doctor who considers himself a toxicologist has ever debated it. He wished that he was humiliated because he didn't know. He thought he was humiliated, but he really didn't know. Next slide. And we talk about this is the Department of Education statistics on autism children aged 16 to 21 served by individuals with disabilities act idea. And then in my state of Kentucky, when 38, 92, 93, right when they started the mandate vaccine program, and 10 years later it's 2,589. And to show that this is not insignificant, look at the rates over here, and this is the rate of percent increase, about 2,500%.
Why is Illinois so high?
You
Is
know,
that because the ADA is based there?
I don't know why. I mean, some people didn't keep good records. Some states didn't keep good records, but most of them did. But the problem here is look how much money we're spending, and we're waiting on this. And most of this is on boys, by the way. And so you see a sex difference. You see and it went up in every state in the union: Alaska, Hawaii, California, Florida, Maine, Nebraska, at the same time. So they're trying to say, how can this be number one? The other absolute proof of stupidity is if you think that genetics causes an epidemic, that an increase in disease this dramatic can be caused by a genetic susceptibility. You can have a genetic susceptibility, which we all have, but it can't cause an epidemic. I mean, that's basic biology. And yet, they spent $25 million in the last years trying to find the genetic cause of autism. And what they found one disease where they found, microdeletion and microaddition, duplication, at the same gene site on 28% of the autistic children. So that just leaves 99.2% unexplained. And just because you find this mutation doesn't mean it caused autism. It may be something that is elevated when you're under oxidative stress, which the autistic children are. Autistic children have less, much less than half the glutathione as age-matched children. So they are under oxidative stress, and the oxidative stress may have caused this mutation, but it didn't cause autism. They have nothing. And the reason they're looking here, and they published this paper, you should read it. If you read that paper, you glanced at it, and you were a layperson with no scientific background, you'd say, oh, they found genes, genetics that causes autism. But if you read the data, it's just absolutely wrong. And they're very, very misleading in what they say. They're liars. I'm telling you, there's nothing else to call these people. They're just outright damn liars. And here's the rate we talk about. Those of you, here's 1938, the first case of autism reported by Dr. Lee Hanna back here in 1940. Here's where the morsol was introduced. And it kept going and went up slightly, not a lot, but we were down here less than 5, or 4 or 5, or 10,000 in 1990. We started the vaccine program right here. And then you see, when you get over here 3 or 4 years later, the rate starts climbing and climbing. And we don't know about what happened here. But this is all data from U.S. CDC. there is no doubt. And people who say we just diagnose them, have you ever seen an autistic child? They're like missing a train wreck. If there were one in this room, you'd know. They're not hard to diagnose. And people who say we're doing better diagnosis are just, again, they're lying through their teeth. They just want to come up with anything except to say that vaccines that they injected without agree cause this problem. Because they did it with safety testing. Wouldn't you think that if you were going to inject vaccine into millions of American babies on the day of birth, that you could take these 50 babies and inject it in and see what effect it had on them? Next slide. This is what the aerosol does. Someone asked us, the aerosol do the same thing to the brain. This is tubulin. This is our first edition of the aerosol, and it just totally wipes it out. Very low concentrations. Next slide. So it does the same thing. If you take a bank of enzymes, this is a coke test. You send your sheet in, you pull a tube that's infected, and you want us to test it, this is what we do. And it's thiiosalicylate, which the gentleman asked back there, said a chelator, totally protected. I mean, it doesn't do anything. I mean, there's no toxicity in thiiosalicylate. If you attach ethyl mercury to it and make the aerosol, it totally polishes all of these enzymes. It's very toxic. And just one second, and this is a comparison to mercury. Mercury is toxic, but it doesn't even come close to the aerosol, mainly because the ethyl mercury penetrates the hydrophobic aspects of enzymes faster than H2 does. Incredibly toxic material.
These doses that you're using in the study here on those correlate real low doses that, saving the child.
Could you repeat the question?
Yeah, he's asking how the doses we're looking at here correlate to real. That's a very good question. The thimerosal is 125,000 animal to 250,000 animal, or 125 micromolar to 250 micromolar. That's 2.5 micromolar. So we're talking, it's this again, and these are enzymes in the test tube. And so they're not new. I mean, we'll talk about some things to show exactly address the question you're talking about. That is important. So there's no doubt. We're talking about the relative toxicity versus what we tested. But this is done in about 5 minutes too. It's not left in there. Okay? So, the observation is that ethyl mercury is a potent and rapid inhibitor of many enzymes. It doesn't have to break down to H2 plus to be toxic. That's one thing we'll say it breaks down, as to this is the toxic one, the ethyl mercury is not toxic. That's not true. In that study I just showed you, there's nothing in there to take the mercury off of the ethyl mercury. And the inhibition of tubular polymerization will disrupt normal connections to prevent the mitotic spindle formation. Tubulin is used in 2 places, primarily in the body, in the brain, for axon structure and function. And whenever you have cells with T and B cells when you're making them, tubulin is on the mitotic spindle. So it is a mercury aerosol on a tremendous at inhibiting cell division. They would be great at directly destroy cancer because they disrupt the tubulin that the mitotic spindles are on. So when you're loaded with this, you cannot have an immune system response. And that's the reason it's called immune system suppressor. And it really is. These are the vaccines, single dose versus multiple dose. The multiple dose vaccines are the ones that really contain the aerosol. This is 1.25 microliters against these enzymes. It just knocks them, it inhibits these enzymes dramatically. It is a very toxic compound, even in the lowest biochemical sense. And the ones in the back are the single dose vaccines. So we're going to bring this up. As today, you buy vaccines, they say it has trace aerosol. What the hell is trace? I mean, 2.5 micrograms per vaccine is the normal level, and some people cause 210 minus 6 grams of trace. Trace isn't a scientific term. It's just something when you don't want to take time to measure. So now we're injecting the children with trace aerosol. If it's trace, you should write down how much it is. Is it a tenth of a microgram, 1 microgram, or whatever? But if it has a trace, like these have, you can see this particular trace was quite effective in inhibiting the enzymes, and a lot of it depended upon the system that's running. And this talk right here, the vaccine aerosol concentration is 125,000 to 250,000 animals. Keep that in mind. That means 10 to the minus 9 molar. 250,000 times 10 to the minus 9, or 125. Because this becomes important when we talk about certain other aspects. Next slide. When we take neurons of culture, put in aerosol, we see all of them were killed in 24 hours after the antibiotic. So this stuff is incredibly toxic to neurons. And this is what this is. Hippocampal neurons that we culture, they stay alive for 24 hours using maybe 3 or 4% activity. And if we increase the level of thimerosal, we kill them rather fast. Yeah, next slide. If you take thimerosal and mercury and add them together, we get a dramatic increase in the toxicity. So they're both going after the same metabolic pathways that get into the neurons to cause neuron death. Yeah, the next slide. So this result is that the ethyl mercury clears blood quickly. The toxic displays a lack of complete and intelligent analysis of that. Don't accept this argument. Just tell them where's it going. And if they tell you it's going out in the people around, we did the calculation. Cheryl, in his first study, measured the mercury feces. And Mark Lansel and I did the calculations. And we showed it would take over 1,000 days to clear the mercury that a child would get in the first 6 months of birth. And we sent that data to the Journal of Pediatrics and we refused to publish it. They wouldn't let us respond to it. When he said it disappeared and went out in the fecal route, there's no way, even at the maximum rate, it would take 575 days that you can clear the mercury from the body from vaccines, based on their own data. Early mercury loss is likely for regional mercury in the body, primarily in the brain and lung situation. Next one. This is the paper I will talk about it back in 1978. This is real simple. The LD1 level of mercury salt. This is a quote from the paper. That means that you injected this into 100 rats and killed one. And they add to that 1/20th of the LD1 of a lead salt. We injected that into rats, 100 rats, and killed none. Mix those two together, killed all the animals. You've got an LD of 100. That's called synergistic toxicity. It makes sense, in biochemical sense, because when you start killing the animals, that means you titrate all the glutathione. You just go a little bit above that, and all that mercury is left with kill enzymes and pathways, etc. So it's not really all that amazing. The synergistic toxicity is something that the ADA, the FDA, and others want to talk about. And yet you'll hear continually in the United States that the level of lead that used to be considered safe is now causing our children to become neurologically damaged. They're losing measurable IQ points in Boston, New York, and major cities where they lead pain. And that's because we started giving them a little bit of mercury to aid in the process of neurodegeneration with the vaccine program. Because it went for years saying this level of mercury, lead, is safe. It didn't cause any problems. Now it does. What happened in the last 15 years to do that? So this is what we call synergistic toxicity. That Dr. Clarkson, who's the big apologist for the amalgam industry, you'll notice he never says two things. He never talks about synergistic toxicity like this, and he never talks about genetic susceptibility like we did before. He never mentions it. He thinks we're all a bunch of white rats living in a pristine cave eating chow that's been measured not to have mercury in it, and purified to include mercury. And that's not the real world. And this is probably one of the most important slides because it's led to a lot of work. And what we did, Mark Lovell, who's my collaborator, a young man who's very good at this type of work, he cultures neurons and culture. He said, we were wondering, why are there 4 boys to every girl that gets autism? Why is there 8 boys to every girl that becomes Asperger's? Sex difference. That's not hard to figure out, is it? So we started looking at the effects of testosterone versus estrogen on toxicity of thimerosal. And again, this is just neurons in culture. There's the control. They live for a long time. If you add aluminum hydroxide, aluminum is slightly neurotoxic. If you add neomycin, an antibiotic, it's slightly neurotoxic. It takes some time to see the effect. But we come back here and let's look at the neomycin. Neomycin here has had very little effect on killing these neurons. Thimerosal's had this much effect. If we add this to this, we get a dramatic enhancement. And I would tell you that tetracycline does this even better. Most antibiotics increase the toxicity of mercury to neurons in culture. That doesn't mean you shouldn't take antibiotics, but it means that if you go in and you're sick, you have a sick child, and that child needs an antibiotic, you'll give him a thimerosal vaccine that day. And you are putting that child in severe danger. Let's talk about aluminum. Aluminum at this stage, in 3 hours, 6 hours, is not toxic at all. You can hardly see. I just put it there. This right here, same level. here's the control, and the Marisol is right here. 50 nanomolar of Marisol, right there. If you put these two together, you get this type of integration. And what this is the synergistic toxicity where you're finding out that the aluminum in the vaccine dramatically enhances the toxicity of the thimerosal in the vaccine. So if you measure those two independently, you're doing bogus deal. The thimerosal and the metals make it much more toxic. This is well known in the literature way before 14 high school. So we know that. Again, they don't consider this bad at all. You see that going down to that. 60% of them are killed. Up here you see that almost none of them are. That tells you that there's a severe synergistic effect of the vaccine with the thimerosal. The most amazing thing happened, and I don't have all of it on the slide. If we went to this line here, just up here at the thimerosal, and we started adding estradiol, female hormone. And what you can do, you can add this, and just keep this, to increase the concentration, and go back up to where you can absolutely give it all of the thimerosal boosts neurotoxicity. We went to the concentration in that same range and added testosterone here, male hormone, and they were all dead in 3 hours. And now, when I saw that, I mean, we redid that because you can't be wrong on this. I'm wrong on this. You want to hang my rear end, the pie, and beat you with a stick while you're doing it. Dr. Barry McComb, without quote, in England, put out a paper. I started reading what they found, just a report. And what they found in women with amniotic, they tested their amniotic fluid. Women who gave birth to autistic children were consistently markedly higher testosterone levels. That was the only difference they found versus the mothers that gave birth to normal children. So there is this thing about autistic children and mothers with high testosterone levels and fathers. Now, the guys looked at this and done a lot of studies. Autistic children rarely will have high testosterone levels, as will their mothers, and most likely even their fathers. So there is part of the susceptibility is based on the testosterone levels that the children are born with. And I think this data is fitting up very, very well in this regard. Have the next one. Now, if you think I'm the only one that does this came out much later than we did, all there, 2006. And you just read estradiol reduces cumulative mercury and associated disturbance of the hypothalamus, pituitary axis, and overactimized rats. In other words, overactimizing so they can't make their own hormones. When you inject in certain levels of the hormone, it prevents the mercury from collecting in the tissue and causing cancer. And that's what we saw in the neurons and function. Estradiol is protected. And this was done with a reduction of mercury content. Now go back, all the way back. The girls can excrete the mercury, right? Boys can't. Remember that first set of slides? Estrogenic effect was associated with reduction of mercury content of the anterior pituitary gland and medial hypothalamus. So we've got a story here, and it's all beginning to make sense. Next slide. And recent publication on molecular and neurological disorders, and what they said that the data demonstrated that thimerosal could alter a neuronal growth factor, induce signaling at concentration lower than those causing neuronal death. So you have an effect on hormone levels of mercury that are not toxic to the cell. They're not killing the cell, they're saying the cell's not functioning right, it's not growing right. And that's probably because it was disrupting the ability for neurons and device to go out and make the proper connections. Next slide. So we've got these observations and we've talked about it, and it really appears that the infants are much more susceptible to mercury toxicity than mature individuals. I think that's a good way. Female hormone prevents mercury retention, and these findings may explain why the autism effect and disorders affect boys at a higher rate than girls, and why we have a boy crisis in this country. Now, the other thing all of you educators want to blame, people want to blame educators, bad education system. I was chairman of chemistry, started about 10 or 12 years, 11 years ago. And what I instituted was a computer system, website. You can go there any hour of the day, 24 hours a day, 7 days a week, and click on and find the lecture you missed, or the lecture you went to that you didn't understand, and have that in real time presented to you and sit there, and most of the kids study at 2 o'clock in the morning, the day before the exam. But, you could go there and you could take the exam. You could take the exam that was given the previous 4 years in that same class to see how well you understood the material. Everything. And the grades really went up. We had this bell-shaped curve. when we did this, we're excited. We thought we're going to ship this curve. These kids are going to be smart because they can study. They don't have to ask me. They can go there and they can work the problem. And with moving computers, you make a mistake. They'll say, here's where you're wrong. You go back and you think, well, we didn't get a bell-shaped curve. We got a double bell-shaped curve. The smart kids, primarily girls, were doing much, much better than they ever had done in the past. The boys stayed right where they were, if anything was going down. It was an incredible fun. But instead of getting a nice normal bell-shaped curve, double bell-shaped curve, the kids that were making A's and B's are now making better A's. The kids that were making C's, D's, and F's are still making C's, D's, and F's. And that's what the computer side will think. I think there's something more wrong with this system than just blaming the educators and TVs or games. We have done something to disable the boys. Okay, this is on the immune system. This will answer your question in detail. This was done by Rampersant Transfusion, 2005. It has not a thing to do with autism in their study. They were studying phagocytosis. They're trying to find what could you give to somebody whose macrophages are eating their own cells. We need to inhibit that macrophagocytic activity, which you really need for the immune system to work. It's where your cells eat bacteria, yeast, and things that shouldn't be there, cancer cells, etc. And they did a study. And guess what? They inhibited phagocytosis more than anything. Aerosol. The second one was straight mercury. And they did it at what they said, 1 to 5 nanomolar concentration. And remember, I told you the vaccines contain 125,000 to 250,000 nanomolar mercury. When you're a baby, you may weigh 10 pounds. You go in and you get 3 shots. On the same day you get the MMR, which has no mercury in it, you get 3 other shots that contain aerosol, so you're getting doses of something that totally suppresses your immune system. And then Dr. Wakefield and other people have found the attenuated measles virus that's in the vaccine located throughout the body of these children, especially in their intestines and even in their cerebral spinal fluid. If you suppress the immune system at the same time you inject, attenuated measles virus, there's nothing. You're not going to have any phagocytic cells able to eat that measles virus. So that measles virus will get inside the cells and start replicating. That's the reason they're probably fine. Attenuated virus in these children. But this tells you just how potent that compound is. Now, this might be great with somebody who's suffering from hemocitosis, where the body's gone dry, but it's not something to do with an old baby or a 6-month-old baby, or even an 85-year-old person who's in a nursing home. Next one. So this is just this is a talk I used to give a long time ago, and they were rats exposed to antibiotics were severely impaired in their ability to excrete mercury. So we have animal studies to back up what we're seeing. Rats on milk versus high-protein diets were much less able to excrete mercury. The great enhancement of synergesis and toxicity of mercury and other heavy metals is well documented in the literature, so we know all of this stuff. Now, most of you have heard about the diet that they put autistic children on. They give them all milk. Case what? They just went after, and there it's back. But if you have an autistic child, if you feed them casein or wheat food, they get sick. Now I'm going to tell you why that is. If you go to those are water-soluble proteins, and if you look at their structure, there's an amino acid called proline. Some of you will understand it. I'm not talking down to those of you who don't. The proline is used if you have a protein molecule, the basic sequence is going along like this, and you want it to turn around and go the other direction. You put a proline there, it'll make a hairpin loop, and the protein will go down and line up. So if you've seen protein structures, I'm sure all of you have seen them, they go like this. Everywhere you see a curve, there's a proline. And proline has an unusual amino acid primary sequence structure. So when you digest it with the normal proteases, you can go out, but when you get the protein, you can't digest it. You need a special enzyme called PP4 that's in the gut that will clip at a proline residue. That enzyme that proline residue, builds up. If that enzyme is inhibited, that PP4, then you make these peptides, and they call them glutamorphin and casomorphin. And they call them morphin because they bind to the same morphine receptors. and they build up in your body, and you find them in the urine. This was done by Paul Shattuck in England and Dr. Weichel in Norway. And they measure these peptides, and they are in the urine of everyone that has neurological diseases. So if you look at this, and you say, well, what's happening? If you're having mercury constantly going down into your intestines from your dental mountains or whatever source, you inhibit this enzyme, you build up the level of these morphine, and that's the reason that some people propose this children behave wildly and badly, because they need certain things, and not only that, they will eat food that's bad for them, such as casein, etc. You take these children off of that diet, their guts get better, their behavior gets better, and it's a marked improvement. Okay, so so in following that, keep in mind that what I just showed you earlier with the MMP enzyme, if you are having mercury go down in your gut, which there's no doubt, you got 74 micrograms a day of feces, it had to go down through your intestines. If that's activating your MMP, that's making you have leaky gut syndrome. So at the same time it's activating the MMP, the mercury, it's inhibiting the PP4 protease. So you're keeping this level of morphologenic type peptides up, and you're making the gut leaker so they can get into the bloodstream. And there's absolutely no doubt about the fact that these things get into the blood and then they're in the urine. So we can see how mercury can account for some of the products we have. Other proteins have proline, but something like casein has 14, in one molecule of casein, you make 14 morphologenic type peptides. So that's the reason that's important. Now, let's go back. This is a study we did, and it just drove people crazy, and they thought, I'm going to tell you, Arizona State University, MIT, everybody has repeated this. It's true. If you go back to infants, it's not true for older autistics. This is the mercury in the hair level. This is the number of amalgams in the birth mother, 0 to 3, increasing going this direction. And this is the autistic to control level, ratio, and the number of children done. And what you see is the autistic children, no matter how many amalgams, the mother could have greater than 10 amalgams, they'll have no mercury in the birth hair. If you go to the controls, they'll have this level in the birth hair, indicating that there is a difference. Now, how does mercury get into your hair? First of all, mercury, when it goes into your body, will not leave your body. This is the vapor. You might lose a little bit. It gets converted to Hg2+. It doesn't leave your body as Hg2+. It has to be coupled to something. It goes inside your cells. Glutathione will bind it, glutathione or cysteine sometimes, and it goes back out into the bloodstream. And when it's in the bloodstream, it gets into the hair follicles, and you have it build up in your hair. These children aren't excreting the mercury. It's staying in their bodies, and that was proved by Jeff Bradstreet and also by Dr. Jim Adams, who measured the mercury in the baby teeth of autistics versus control children, and showed that even though they had almost very little in their hair, they had a lot in their baby teeth, more than control children. And so we said this is an indication that autistic children represent a subset of the population that cannot excrete mercury. And then comes along a lady from the University of Arkansas Medical Center, Dr. Jill James. She used to be a CDC researcher, and now at the university. And what she showed was that the autistic children have roughly less than somewhere near half of the glutathione levels that normal children have. And glutathione is the molecule in your body that binds to mercury and excretes it. So this all fits. It's like, we'll go faster. This is just the amalgam count. You look at these autistic children, they're all way in here. They don't excrete any mercury. And the mothers have had the amalgams, and most of them are in this range. There's some up here. But some of these should have been up here. They didn't have the next line. Here's the ratio. If you were normal, this is the amount of mercury, and you were one of the people that had 8 to 15 amalgam fillings, this is the amount that you would have if you were an autistic child, and that same mothers with the same level of amalgam fillings, you're down there. There's no doubt. These children are not getting rid of the mercury out of the lungs. Next slide. And the real critical one is this slide. As you see, as the level of mercury in the birth hair goes down, the severity of the disease goes from mild, moderate to severe. So the less mercury in your hair, the more severe the autism. And let's look at this one just for a second. Female versus male. And you see almost all the females are down here below low mercury excretion, and the males that get the mild case are up here, the better excretors. And what this just tells you is that females have to be much worse at excreting mercury than same level of disease as the males who are in better experience. So we're seeing both the genetic susceptibility with response to the mercury to the neurons, as well as the inability to excrete the mercury. Can I go to the next one? Okay, now let's talk about some of the data, because there's always been this thing you'll hear in the ADA, dose makes the toxin. It's not true. I mean, it's a factor. That's what they'll always say. The dose makes the toxin. Well, I can probably outrank any Eskimo, and Mike Margolis can outrank me. So, there's a genetic susceptibility, right? I mean, we all know that. But if we look at this data in the favorable ions, 7-year-old children, the blood pressure problems increased with decreased blood mercury levels. Why? And they're using that as a measure of exposure. This is the conundrum. Why did that happen? Well, I would submit to them that the decreased blood mercury is because the mercury staying in your brain and in your heart tissue, maybe these are the kids that are developing IBCM. Then we go down to the next big study, which shows 700 children, boys with higher levels of hair mercury performed better on some tests as the Boston Anemia test. So the more they were exposed to mercury, they assume, and the ADA said, this just makes it right. A little bit of mercury is good for you. Just build up a couple of pounds of liquid mercury in their ability. If they think that's what I'd like to spark them up somehow if I could. But this is saying, the children that are excreting more mercury have a better IQ. They have better mental abilities. And I challenge them on this. They don't want to talk to me about it because it makes a lot of old toxicologists not look too damn smart. Because when you run into something that doesn't make sense, I get excited. You turn out the lights, you get a glass of red wine, you sit over in the corner, and you think, this big. And you have to sit there, you have to think about it. But things aren't always obvious. You just sit there. And I remember when I started reading all this stuff and getting that data, you're afraid. Okay, you have no fear. It's like, I have my fear. People are afraid of it. I'm afraid of looking like a fool. I don't like that at all. I don't like that feeling when I make a mistake. It's just something that scares me. If I think I'm going to talk about something that I don't know anything about it, I usually will run. But anyway, when you look at this stuff, somebody should have looked at it. This was telling you something. This is, we cannot determine the level of mercury exposure by looking at the level in the blood or in the hair, and all of the research is published is now. Next slide. So these are just the observation. And the concept is that little levels of mercury in the hair and blood do not imply a lack of toxic exposure of mercury retention in the blood. And the stuff in the heart, we have 174,000 nanograms per gram. That right away should tell you the measurement amount in the blood. If you get over 50 micrograms per liter of mercury in the blood, you're considered to much up. And you're getting close to where you're going to have real clinical effects. And if we look at that, that's much higher than that. It's still makes sense. Oh, here's what we're going to talk about politics. The IOM report. They did this. It was funded by the Center for Disease Control. This is the politics aspect of the talk. They reported the report predicted aerosol as being involved in autism and recommended that no further research be done in this area but to investigate other more fruitful areas like genetics. Again, this was a full whitewash. The IOM report was based on 5 epidemiological studies of questionable levels. I'm going to point out to you where these came from and how they were generated. And it totally dismissed the basic science research on aerosol toxicity. Because when I add aerosol to neurons and culture and I report that in literature, you can bet any scientist out there that does the same thing, repeat my experiments, and if I'm wrong, they're going to shove it down my throat. We enjoy doing that science. We enjoy going to nail somebody who made a mistake if they're not careful. A recent congressionally requested NIH committee looked at the 2004 IOM report and gave it a very, very bad evaluation. They said the data they used cannot be used to make the conclusion that we shouldn't do any more studies on aerosol. But the CDC did fund it. They funded the chair to go shoving out of the blood too fast and be toxic. That's the kind of fund. But they will not fund a study looking at the Amish population to see why they don't have autism. They don't get vaccinated. And I would point out, if you think I'm all base, the United States is number 41 on the infant mortality list. In other words, there are 40 countries where infants live at a higher rate than in the United States. So we have the most highly vaccinated children in the world, closer to warm housing, good food, a pharmacy that's usually within 10 minutes of where you live, to get stuff to drop your gene. And yet there are 40 countries where the children live longer than we do, have less neurological disease than we do. Nobody's getting mad. I have next slide? Okay, here's where the study came in. Who did the epidemiological studies? All of the CDC data, this was done by Rashad, and I don't know Rashad. I've seen him talk. That he's I think he's Denmark, Danish or something. I think that's very wrong. But he first showed autism rates when ants by aerosol exposure, and he modified this, which we'll talk about later. We'll talk about how they lost all of that. Two studies were done by Danish, Madsen, and Gibbet, who worked for the Stanford Serum Institute. And SSA makes the aerosol-containing vaccines and sends them to other countries because they're not allowed to use them in Denmark. They still do not keep the aerosol. They don't use it. Yet you'll see that what they said is that when they took the aerosol out, the autism rates went up. So if the Danish believe them, why don't they put the aerosol back in their vaccines? Why don't the Swedes put it back in their vaccines? They didn't do that because nobody did this study except the CDC because of the money. One study was done in England by Miller, and after the results were known, at the IOM, the National Health Service removed the aerosol from these vaccines. That was after the meeting. So we're having everybody say, no, we don't believe this result. We're taking the aerosol out of the vaccines except the Americans. The trouble is, why the opinion of the FDA is based totally on foreign conflicted opinions, and why couldn't the CDC find epidemiologists in the United States to do the studies? Which when we took this out, we pointed, and primarily is because you can't see anything. We'd like to get Verstraeten back in on the witness stand. You can't do it. Okay, and the Verstraeten study differed from the Danish and English study in that it did not show the dramatic protection effected by the aerosol against autism. Next slide. Look all this up. Here's the Verstraeten studies. 1998, I wrote a letter to the FDA, and it was based on the fact that I'm very allergic to aerosol. I was a young soldier in 1964. I got a lot of shots. And when in 1974, 10 years later, when I was a professor, I tried to wear contact lenses. I've never had such an unpleasant experience as when they put the aerosol in the contact lens solution in my eye. They couldn't get it out fast enough. My eye was red for a day. I was an assistant professor at the University of Wyoming, and what would you do? You'd go read about the aerosol. I thought, who in the hell would put this in anyone's eye? From the toxicity, just from knowing the biochemistry and chemical toxicity. So I wrote him a letter saying, because someone asked me to, and I did it to the English equivalent of the FDA also. And in 1999, Verstraeten did his first study. He was very honest. I listened to him. I think he probably suffered throughout this whole series here, working with our Center for Disease Control, which were trying to get him to say something he could not say. And they found that the relative risk was 7.62, which means that the aerosol absolutely was the cause of autism. He compared vaccinated against non-vaccinated children at this time. And they said, well, that's not fair. Let's compare those who get one vaccine on the day of birth to those who get, didn't get it on the day of birth. And of course, the relative risk was 2.48 drop. That still indicates it's toxic, and it's a cause. Even the 1.69, which was his third study. And then you got the fourth study, which was presented at the Simpsonwood meeting. And I would tell all of you, go to SaveMinds.org, read the Freedom of Information Act material, and you will see that it absolutely shows that our government, the Center for Disease Control, administrators at that time, were working hard throughout this entire period, from emails we got, conversations, working hard at covering up the fact that the aerosol caused autism. It gets down here to a 1, which means it has no effect. They published it in 2005, and then all of the authors and the Center for Disease Control and everybody involved lost all the data. I mean, we paid the CDC to keep this data, but you cannot find this data to go back and see how did he generate it. This is a very significant drop in relative risk, but it smells like hell, and you would not believe it. And I would point out that here means it had no effect. It increased the rate or it didn't drop the rate. And next slide. This is what the Danish study found, done by people who work for a vaccine manufacturing industry that puts the aerosol vaccines and sells it to China, Cuba, and every place else. And they go along and they have almost no autism. They look at this. They're down here below 1. They're lower than we are. And here's where they put in aerosol was removed from the vaccines right at this time. But what they don't point out in the paper is that at this time they included a large Copenhagen clinic to the database. They added outpatients in 1995 here, And the autism classification changed in 1994, which is somewhere here, right here. And so the rate went up, and at the time it went up, they were still less than 4 or 5 per 10,000, which was the rate that we had in the United States before we started the mandated vaccine program. This time, the rate here was 1 in 166, or 60 per 10,000. So we're here at less than 5 at the highest rate. In the United States, we're up to 6. Now, this is totally different than the Verstraeten studies. He said there was no effect. If this were Verstraeten were correct, this would be over here at this time. So they manufactured this data, and they put it in there, and what it is, it tells you that they're a bunch of, they're trying to deceive the people who read these papers who don't understand how to read scientific publications. And I would point out that the big question is, if the Danish study was right, based on Danish and Swedish children, why don't the Danes and the Swedes and the English and the other people in Europe put the aerosol back in the vaccines and drive this rate back down here? And that's because nobody believes it. You have two conflicting reports. The CDC didn't even mention it. One says it didn't have any effect. The other one said it caused an increase when you moved it. And if you think about it, it's like saying, I went out and I drank a lot of booze last night, and it made me more sober. I mean, it's on that level of stupidity. And they sell that, and they sell it to Congress, and basically, Congressmen aren't even stupid enough to believe this, but they're smart enough to know where the next lobbyist check. Yep, next slide. These other considerations, Tony Bateson, English fellow, I've met him a couple of times. I asked him the first time, I said, go look at your autistic, because he told me that something like 15% of the children in England weren't vaccinated from this age. I said, go find out how many non-vaccinated autistic children you can find. And he found 2. They said, the children said, we should have found hundreds. So we can say there may be other causes of it, but it's not there. When I testified in front of the 2004 IABDM committee, I said, let's look at the Amish population, the Mennonites. They live right next to us. We buy their food all the time. I love those people. They're very, they live differently than me, but I sure think they're honest. He went there, I think he found 2 in Lancaster, I think he found 2 or 3 autistic children. And the 2 of them he could identify had both been vaccinated. The third person couldn't talk to him. We found none of the autism. And we went to the clinics and treated these children. And the people told him, we don't have that disease in our population. So why doesn't the CDC do the simple thing? Go to the Mennonite, Amish, other religious groups that refuse to vaccinate, and see what the rate of autism and asthma is in those children. And they absolutely, totally refuse to do that. And Health First, the Chicago clinic that does not vaccinate at least in the first year of birth, reports no autistic children born, a population of about 35,000 children, and 1 asthmatic. So we have all this data and the ability to do it. And I would report to you, if aerosol isn't causing this problem, and you look at that last vaccine data from Manitoba on the asthma rate going up, or the earlier you get it, and our vaccines today aren't safe at all, even though the aerosol is being approved. So you have one choice or the other. It's either early vaccination at low levels of aerosol, or it's just not like that.
What are they using in place of aerosol as a preservative then?
There are phenol compounds, and there are different ones used, or they're not using anything, they're just doing single dose volumes.
Are the single dose values safe?
I don't know. I don't know that anybody can say it's safe. I don't know that there's any vaccine safe to give to a baby on their birth. So I think, and by the way, I'm very pro-vaccine. I vaccinate all my animals to get over. And if I were going someplace with yellow fever, I'd get a vaccination. I'm not anti-vaccine. I just think we need a safe vaccine.
What, tape change, hold on.